Is the CDC's vaccine adverse event reporting system broken? That's the question asked by one of the top medical journals in the world after an investigation found the CDC's VAERS system, meant to track and study vaccine side effects, is overwhelmed. The British medical journal says reports submitted by doctors and a state medical examiner are not being followed up on, and signals are being missed. Here's an excerpt straight from the journal. Quote, "The BMJ has spoken to more than a dozen people who have filed VAERS reports of a serious nature and were never contacted by clinical reviewers or were contacted months later. Some of those making reports were told conflicting information about updating their report or were discouraged from making a report altogether." The BMJ's investigation raises concerns over transparency. According to the BMJ, the FDA and CDC essentially have two VAERS databases. The public one contains only initial reports. Then there is a non-public back-end system that contains updates to those cases, such as whether a person recovered or died after experiencing adverse effects. Of the people the BMJ spoke to was Dr. Patrick Whelan, whose 7-year-old patient had a cardiac arrest after the boy reportedly received a COVID-19 vaccine. The patient was on a ventilator when the doctor filed a VAERS report. Dr. Whelan says months passed before he received a response. Medical examiner James Gill was also interviewed by the BMJ. Gill reported to the CDC that a 15-year-old boy died days after getting a second COVID-19 shot. After the autopsy, Gill says the teenager's cause of death was cardiomyopathy due to the COVID vaccine. The CDC refutes Gill's findings. The CDC has not acknowledged one single death linked to COVID vaccines after reviewing more than 20,000 preliminary reports. Other countries have acknowledged deaths to be likely or probably related to mRNA vaccination, with far fewer reports. Before the COVID-19 pandemic, VAERS was receiving nearly 60,000 adverse event reports each year. There has been an unprecedented 1.7 million reports made since the rollout of COVID vaccines. 1 in 5 are said to meet the criteria of being serious in nature. The CDC told the BMJ at any given time there will be several dozen to hundreds of staff members to meet the needs of the office. But the BMJ says that's an inadequate number, comparing the CDC's staff to Pfizer's, which has thousands of employees reviewing vaccine side effects. There have been more than 675 million doses of the COVID vaccine administered, so the number of problems reported through VAERS is minimal compared to the number of COVID shots given. The CDC says public information on these reported adverse effects is limited out of patient confidentiality concerns. The BMJ concludes, interestingly, the FDA adverse event reporting system, which collects reports on drugs, does maintain a publicly accessible database that gets updated, as does the agency's medical device reporting system, raising the question of why VAERS can't do the same. U.S. childhood vaccination exemptions just reached their highest level ever, as vaccine hesitancy persists past the pandemic.